Hello everyone, in today's part we will be studying about all the disorders in the chemical coordination and integration chapter. That would include pituitary disorders as well as thyroid disorders, pancreatic disorders, adrenal gland disorders like Addison's disease, Cretinism and Cushing disease, Virilism, Gynecomastia and all the remaining disorders that are given in this chapter. So let's start today's part. So let's start with the first part, that would be the pituitary disorders. So as you know, pituitary have mainly two part, anterior and posterior pituitary. Anterior pituitary meaning past distalis have many secretions. Some disorders that are given would be the GH or growth hormone related disorders. So let's start the first disorder that is in NCERT is gigantism, that is due to the oversecretion of growth hormone. The second one is dwarfism, that would mean pituitary dwarfism is the exact term given in the NCERT, meaning a bit low size on the pituitary gland and overall low size development. It is due to low secretion of growth hormones. And the third is the acromegaly, which is due to excess secretion, which causes disfigurements mainly in face but may cause death in extreme cases. So there are one acromegaly, there is a term excess secretion, and in gigantism there is over secretion of GH. Both could be used simultaneously for any of them, but it would be required to give exact option if that is present in the MCQ part. So let's move on to the posterior pituitary. Or as you already know, past nervosa have two secretions, but oxytocin and ADH, of which ADH one disorder is given. Vasopressin is our antidiuretic hormone is ADH full form, and vasopressin is also a name it is used by. It acts mainly on the kidney and stimulates reabsorption of water and electrolyte by distal tubes. It prevents diuresis, which is loss of water through urine, and the disorder that is due to it is diabetes insipidus. Its affects synthesis or release of ADH, resulting in diminished ability of kidney to conserve water, thus causing water loss or dehydration. Moving on to the thyroid disorders, the first disorder is due to hyperthyroidism, that would mean the excess hormone secretion or excess hormone production, which its cause is thyroid cancer or due to development of nodules of thyroid gland. And it is a autoimmune disorder meaning antibodies which emits the action of TSH and overproduction, and this will reduce the overall thyroid, overproduction of thyroid hormones. Moving on to its effect, it would cause increase in BMR, basal metabolic rate, weightlessness, weight loss, and high metabolism would be one of its causes or one of its effects. And its cause is thyroid cancer or development of nodule, and its effect is increased BMR, weight loss, and higher metabolism than normal. Then one of the disorders or cases of hyperthyroidism include exophthalmic goiter, also known as Grove's disease or Bestow's disease. It causes increase in BMR, increased body temperature, increased heart rate, weight loss, enlargement of thyroid gland, protrusion of eyeball, also known as exophthalmos, and due to accumulation of the fluid. Since hyperthyroidism is covered, let's move on to hypothyroidism, which is due to low hormone production of thyroid glands. Its cause is iodine deficiency in diet or thyroid damage or congenital diseases that are present since birth. And congenital diseases are also long term, very long lasting. Now some of the diseases given in hypothyroidism case is goiter or simple goiter, and that was in the hyperthyroidism case, that was exophthalmic goiter. It is simple goiter or simply known as goiter. So let's start talking about simple goiter. So it is due to enlargement of thyroid gland, or you could observe thyroid gland for people suffering with simple goiter. It is due to iodine deficiency in our diet, and hypothyroidism's cause would of course be its cause, as it is one of the effects observed in hypothyroidism. Cretinism, the second case given, due to decreased production of thyroid hormone during pregnancy, it leads to abnormal fetal development, dwarf mutism, stunned growth, meaning growth stops, mental retardation, abnormal skin, and poor mental and sexual development. low intelligence quota, meaning low IQ, and decreased body temperature than normal. One more cases is Myxedema, which is decreased secretion in adult women, causes irregular menstrual cycle. Since thyroid part is covered, let's move on to parathyroid disorders, which is due to one cases. One is hypersecretion meaning increased PTH, meaning parathyroid hormones would be a bit higher, and increased blood calcium levels, and its effect is bone dissolution or demineralization, and it leads to osteoporosis or weakening of bone and increased chances of fractures. The second would be hypersecretion of parathyroid hormones. It is decreased parathyroid hormone, low blood calcium would be its effect, and it is also causes hypocalcemic tetany. Low calcium in the body fluid activates our muscle to raise calcium ions into the sarcoplasm, which leads to spasm or wild contraction in muscle called tetany. Moving on to pancreas now. Its disorder given is diabetes mellitus, which is an autoimmune disorder. It is due to prolonged hyperglycemia, meaning higher blood sugar concentration, more than 180 mg per ml or more. Its cause is destruction of beta cells, resulting lack of insulin, and its indicator is one is glucosuria, which is loss of glucose in urine, and ketonuria or ketone bodies in urine. Let's move on to adrenal gland disease disorders. So the first disorder would be the Addison's disease. It is an autoimmune disorder. Its destruction of adrenal cortex lead to acute weakness, fatigue, and decreased production of hormones of adrenal cortex. Decreased sodium, iron, and water in blood, and reduced BP, increased loss of sodium ions and water are its effect. Now the next syndrome in adrenal gland is Cushing's disease. It is due to hypersecretion of adrenal cortex. Its cause is increased blood sugar, decreased immunity, and blood pressure and volume increases overall. The third and fourth diseases are a bit more important. One is adrenal virilism. So adrenal virilism is increased production of sex corticoid, male corticoid in female, and excessive growth of hairs, meaning male pattern. It is also known as male pattern or Virilism, and it causes low pitched voice and may decrease fertility in long term. The last of the adrenal gland cases is Gynecomastia, or the increased production of female sex corticoid in males. High pitched voice, mammary gland development are its two effects. That would be all for the today's part. It covers complete disorders in the chapter chemical coordination and integration.